Welcome to Maximize Productivity and Security in Healthcare and Life Sciences. I'm Christina Wong, and I lead the Healthcare and Life Sciences product marketing function at Docusign. Docusign is the world's #1 way to sign electronically on practically any device from almost anywhere at any time. I've been in the healthcare and life sciences industry for almost 20 years, and I've worked on the private, public, and nonprofit sectors, starting in the California State Legislature, moved into local government, and then worked for some of the biggest name brands such as Johnson & Johnson, all working on healthcare policies and new technologies. So before we begin, let me just note that this presentation includes estimates, projections, and forward-looking statements, so please refer back to the safe harbor statement on the screen. So I'm very excited today to welcome 2 additional speakers today to help us talk about productivity and security. First is Ron Romano. He is Docusign's Distinguished Value Consultant, where he works directly with our customers to identify high-value use cases and then quantifies the expected and then actual value realized. Prior to Docusign, he was a nurse and a nurse administrator for 15 years. Our second panelist is David Holding. He is a director of global healthcare security and compliance strategy at Microsoft. He has over 28 years of global experience in the industry with an expertise in cloud computing, privacy, security, compliance with AI and machine learning. So what we have for you today is really to talk about how Docusign and Microsoft are going to have seamless out-of-the-box integrations that help streamline your process, reduce costs, and gain productivity. In particular, in this industry with compressed margins and high competition, as well as having to meet these patient expectations and have outcomes, this is really about being critical to your business on having to look at the productivity and costs in your organization. Ron will actually discuss 2 real-world case studies in which these customers have gained over $4 million in productivity gains with the Microsoft and Docusign integration. Secondly, David will then cover how security and trust are at the center of all of your business processes. We will have Q&A at the end, so please submit your Q&A and we will answer them at the end. So let's talk about what we are looking at. This is about 26 days lost per employee per year, according to the Harvard Business Review, about productivity losses by just your employees toggling between applications. This is not talking about actual work that they're trying to do, but just that mere task of toggling between applications is the hidden cost here. And what's at the root cost of this? It's 2 things. It's a lack of integration and a lack of automation. So let's dive a little bit deeper here. Most organizations have about 976 applications, but only 28% of them are integrated. So we're not talking here today about integrating 100% of your technology stack, but there does need to be more integrations if you want to address process inefficiencies and security risks. These are really key. The second piece of this root cause is really about automation. This manual inputting of data, correcting errors, is a major source of productivity losses and delays, and it really undermines your organization's ability to realize the full value of the systems that you have in place. Another key overlooked process is around your agreements, or it's around your documentation. Healthcare and life sciences is full of paperwork. Healthcare is one of the few industries left that uses a fax machine, and this is about lack of interoperability across that care continuum. There's a lot of different organizations that don't talk to each other, so there's a lot of paperwork and manual paperwork that flows between this. This is the same when it comes to the pharmaceutical value chain. When you're looking at the drug development processes, there's so many entities that are cuts across there, and what you need all of this paperwork to go across these organizations. Whether you're talking about NDAs, MSAs, credentialing, there's countless of agreements that underpin these critical business processes. And within each of these processes, the agreement needs to be created. It has to be committed to what you committed to in the agreement, and they have to be stored and managed in a way. And the fact that most of these are detached and in silos creates huge productivity losses and increase in costs. And also, there's valuable data in these agreements. Agreements have some of the most trusted and sensitive information, and these are locked in static paper. So we call this entire process the agreement trap. And when we have this agreement trap, you have to be able to address this to unlock the potential to be able to have more automation and more productivity to deliver a pathway that you can streamline your processes, drive efficiency, automation, innovation, and liberate this valuable data. Underpinning all this is security. There are challenges. Last year, the HHS cited that 540 organizations reported healthcare data breaches impacting more than 112 individuals. But at Docusign, this doesn't have to be a trade-off. We don't believe in the false trade-offs between efficiency and risk. And the two main areas that we focus on are platform security risks and secondly, information security risks. So let's dive deeper of what Docusign does to address this. The first is that we are one of the most trusted brand names in the industry, and that's because we really invest highly in our security. Just to name a few certifications, Docusign is ISO 27001 compliant, certified. We adhere to PCI data security standards that handle credit card information, both as a service provider and a merchant. And just to give you a sense of how serious we take this, we're one of the few limited number of companies in the world that adhere to the binding corporate rules approved by the European Union data protection authorities. Our products adhere to 3 pillars of information security mitigation: the control and access, where you make sure that the right people have access to your system. Secondly is monitoring, ensuring that you prevent outsiders into your system. And third, which we talk a lot about today, is around digitizing processes so that your risk is reduced, your exposure is reduced. Through the Docusign and Microsoft integration, we address all 3 of these pillars. We entered into a strategic partnership in 2022 and have extensively co-built products to address the agreement trap and security. We have out-of-the-box integrations with these applications that you see here, so you don't have to buy anything new. You'll see that we cover the entire creation, commitment, and management process. And I just want to call out a few of these areas. First is e-signature. So in life sciences, we have a purpose-built product that adheres to the FDA 21 CFR Part 11 regulations. This requirement of the 2-factor authentication and putting a signing reason. Our e-signature product is integrated in Power Platform and Microsoft Dynamics 365, and that includes automated signature workflows, pre-built templates, and visibility into that signing process. When you're looking at generating and managing the agreements, we are fully integrated in Microsoft 365. That means that you can send, you can sign, and you can track these documents all within SharePoint, Outlook, and Word. No toggling anymore. And in Word, we brought our special technology in which you can have a legal clause library, and it can directly access this library in Word. And we have an AI-powered risk scorecard directly in Word that helps you with your redlining process. So Microsoft and Docusign have invested a lot in their identity and security platform, as I mentioned. Just to give you a sense of how much we've invested, last year we released a new product functionality called liveness detection for ID verification. And this uses AI-enabled biometric checks to confirm that signers say who they are and they don't have to be present at signing and you can ensure that their IDs are valid. So this prevents the use of fake documents. We have a product called Monitor that's fully integrated with Power BI. And what that does, it allows you to analyze and track to make sure that you have real-time visibility to detect any potential threats, to make sure that only valid users are in your system. And then lastly, we are fully integrated in Microsoft Teams. So one of the key areas that our customers use us for is in telehealth, so that you could have signing sessions, including signing consents, right in Microsoft Teams, and you get notifications about the signature right in your chat. So now it's no longer talking about theory. I'm going to turn it over to Ron, where he is going to talk about real customers who have quantifiable cost savings and value.
Thank you, Christina. Now that you know how Docusign and Microsoft strategically partner to meet the needs of diverse use cases across an organization, let's take a look at two real-world examples. The first case we'll examine involves the good practice or GXP document retention workflow at a top 10 life sciences company. GXP refers to the good practice guidelines and regulations created to ensure that life science products are safe, effective, and usable. The X in GXP can refer to a number of disciplines. For example, there's GMP, good manufacturing practice, GDP for distribution, GLP for laboratory practice, and many more. Knowing that the data and documentation is accurate, up to date, and accessible, yet secure, provides a high level of confidence to both companies and regulators. Now let's take a look at the redesigned GXP document retention workflow of this top 10 life science company. The applicable GXP document is downloaded from an external system, populated using Microsoft Word, and then uploaded to a Docusign web application where the data is imported into a Docusign template. The document is then digitally signed in Microsoft Teams by all parties. Once completed, Docusign Agreement Actions pushes the document to external systems for archiving, triggering downstream tasks via Microsoft Power Automate. Finally, the preset document retention period, one of these downstream tasks, ensures the document is automatically purged at the appropriate time. The integration of Docusign and Microsoft provided this company with a seamless, digitized, and automated process that ensured a high level of compliance and security. Let's take a look at the productivity value associated with this significant improvement. Docusign has a value calculator that allows you to calculate cost savings, revenue generated, and time saved. Using this calculator, the redesign of the workflow that includes the integration of Docusign and Microsoft resulted in a 67% process time improvement, or 40 minutes per unit of volume or per instance, over the old manual process. Process time is that total amount of time expended by staff that are involved in the workflow. Now that 40-minute time reduction, when applied over the company's annual volume of 240,000, saved more than 160,000 hours of processing time for the year, liberating 77 full-time equivalents, assuming a 2,080-hour work year. And at the average fully loaded hourly rate of $25, now that's salary and benefits, that process time savings is valued at about $4 million, or $17 per unit of volume or per instance. Now imagine how much you could gain if you implemented additional efficiencies throughout your organization. And the value extends well beyond the productivity gains from automating manual tasks that keep documents moving. The company benefits from a more secure process, ensuring the highest levels of trust, transparency, standards conformance, and regulatory compliance. As Christina mentioned, automation is the key to security gain where documents are not floating around or in less secure methods like email. Having systems connect and automated lends to increased control and security. Errors and miscues like missed downloads, downloads to erroneous locations, incorrect naming conventions, the submission of unsigned documents, among others, have been eliminated by automating manual tasks, thereby eliminating the need for time-consuming and costly rework. What's more, the digital end-to-end experience and automated workflows has afforded staff the time to focus on more meaningful, fulfilling, and top-of-license work, improving morale and satisfaction. Let's take a look at our second real-world example. In this case, we'll examine the improved new hire onboarding workflow at yet another top 10 life sciences company. New hire onboarding is the crucial process through which new employees integrate into an organization. It usually begins with administrative tasks that are typically handled by HR before moving to company and role-specific training. Let's take a look at the improved new hire onboarding workflow of this top 10 life sciences company. The process begins when the talent acquisition representative submits new hire information via a Microsoft Power Pages form. This information is then written back into a Microsoft SharePoint list, at which point Microsoft Power Automate triggers the distribution of onboarding forms to the new hire using Docusign document generation. The robust functionality of Docusign facilitates automated, rules-based form selection and pre-populated fields such as demographic information. Now, the new hire digitally completes and signs all forms, while Docusign ID verification ensures security and compliance. Once submitted and received, specific form data is written back to specific designated SharePoint lists, triggering downstream tasks such as provisioning tools for the new hire via Microsoft Power Automate. Again, the integration of Docusign and Microsoft provided this company with a seamless, digitized, and automated process for new hire onboarding that generated many benefits for the organization and the new hire. Now let's take a look at the productivity value for this case. Again, using that value calculator described earlier, the redesign of the workflow that includes the integration of Docusign and Microsoft resulted in a 72% process time improvement, or 43 minutes per instance or per unit of volume over the manual process. Now that 43-minute reduction, when applied over the company's annual volume of 45,000, saved more than 33,000 hours of processing time for the year, liberating 15.5 full-time equivalents. And at an average fully loaded hourly rate, remember, salary and benefits, of $25, that process time savings is valued at over $807,000, or $18 of value per unit of volume or per instance. Similar to that first case, the value extends well beyond the productivity gains. New hires will feel more comfortable with the process, knowing that their personal information is secure and private. As a result, they're more likely to comply with all of the onboarding steps as directed. Errors and not in good order items like missed or incomplete data fields, misformatted data, submission of unsigned forms, data entry errors, and misrouted items have been eliminated by automating manual tasks, thereby eliminating the need for tedious and costly rework yet again. These types of delays can be even more costly than they seem, especially if they lead to corresponding delays in service provision and revenue generation, or lead to the necessity for costly alternative staffing. Here's David with more on security and trust.
Excellent. Thank you very much, Ron. And so where I'm going to add to that is the security and trust provided by the Microsoft Cloud Foundation and our partnership to Docusign and to health and life sciences organizations worldwide. So if we look at security and trust, there's the trusted foundation of security and compliance in the Microsoft Cloud. So Azure Dynamics 365, Microsoft 365 Power Platform, very secure hardened cloud, but also well over 100 compliance certifications. But we know that our health and life sciences organizations want to put workloads on top of Microsoft Cloud. So those workloads need to be secure and compliant. We know that they have end-to-end IT infrastructure. The end-to-end IT needs to be secure and compliant. And the organization, the health and life sciences organization as a whole, needs to be secure and compliant, because a lot of compliance requirements and security risks can go outside of IT. So we, in addition to Microsoft Cloud Secure and Trusted Foundation, we provide partnership to our solution provider partners, Docusign included, and also to our health and life sciences organizations worldwide. Risk management is a very important part of this, in terms of, there's ransomware, there's breaches, there's insider risks, there's denial of service, IP theft, and so forth. And how can you work with Docusign and Microsoft to mitigate those risks? Another part of it is compliance. So how can you be compliant with a given regulation or data protection or privacy security standard, whatever your jurisdiction may be? And how can you leverage the Microsoft Cloud extensive portfolio of compliance certifications to help you in that journey? There's this notion of shared responsibilities and inheritance, where you can lean on your cloud provider to help with your security and compliance. That's a wonderful part of the cloud. Global scale. So where your data is located is going to impact the jurisdiction, the applicable regulation, data protection, or privacy security standard, and you can control where your data is located. So extensive footprint for Microsoft Cloud, and you control your data. Looking at it more broadly, you control your data from a privacy standpoint in terms of what's collected, what's used, how it's processed, how it's stored, how it's shared or disclosed if that's done, how it's disposed of. So you control your privacy, you control your data, including where your data is located. So if we look at health and life sciences and we look at the end-to-end IT, gone are the days of decades ago where we had the intranet, the secure perimeter, and the internet, and you could authenticate once and move around freely. We have a much more complex end-to-end IT environment, and in a sense, the perimeter is blurring. And so we have extensive Internet of Medical things. We have the medical devices, of course. We have corporate devices, personal devices, bring your own device, remote work, virtual health, telehealth, telemedicine. And of course, there's still on-premise data centers in that mix of end-to-end IT. There's cloud and there's Microsoft Cloud, but many of the workloads that are migrating from the on-premise to the cloud, that can be a lengthy procedure. If it's an electronic health record system, it could take 1.5 to 2 years to do that migration. During that time, you essentially have a hybrid workload. Some is on-prem, some is in the cloud. For example, production is generally last environment to go in the EHR. Some of the first are reporting, maybe disaster recovery because of the high ROI. But, organizations need to be secure. They need to be compliant throughout that whole migration, throughout that hybrid phase. There's a notion of multi-cloud. It's a reality that we recognize with a lot of our health and life sciences organizations. Whether it's through acquisitions or mergers or other reasons, multi-cloud is a reality. They need to be secure and compliant with multi-cloud. Shadow IT, unfortunately, that's a reality, and there's risks there. Third-party risk, we hear, is a major risk concern for many health and life sciences organizations, whether it's business associates or data processors or vendors or suppliers. Managing that risk is a big challenge. And healthcare networks. You've seen what happens when a large-scale healthcare network goes down. It can impact many, many different providers, payers, and so forth. So the message here is there's a complex end-to-end IT environment. The perimeter, the security perimeter is blurring. And Microsoft's answer to this, we live and breathe this internally at Microsoft. We highly recommend it for all our solution provider partners, and we highly recommend it for all of our health and life sciences organizations worldwide. And that is this principle of zero trust security strategy and the approach underpinning that. And let's dive into that a little bit, talk about what we mean by that. So in terms of the key principles of zero trust, verify explicitly. So again, rather not just authenticate once and move around freely, zero trust is about verifying each access explicitly. Using least privilege access. So if you think of the role of a healthcare worker, they have minimum but sufficient privileges for their role. And not just in terms of the role, but in terms of time. If they need elevated privileges for a given task, they get those granted for that task and then ratcheted back afterwards. So that's the principle of least privilege. Assume breach, it has to do with the fact that as good as we get collectively, Microsoft, Docusign, and health and life sciences organizations at mitigating risk. There's humans involved, things happen, security incidents are going to occur. When they do occur, you want to be able to limit the movement of an intruder in the network, and you want to be able to limit the impact. You want to contain it. You want to limit the blast radius in a sense. So there's many important elements to how that is done. And you also want to have a continuous monitoring, detection, and response, again, to ensure that security and trust throughout the end-to-end IT environment and the organization as a whole. So in terms of key security controls, think of the Microsoft Cloud, the Microsoft Integrated Security Suite to augment what DocuSign was talking about. There's strong identity, think multi-factor authentication, think Microsoft Entra for least privilege. You're adding things like privilege identity management, again, to manage those especially elevated privileges on the timeline, keeping minimal but sufficient privilege on the timeline for each role, each person. Device health, think of hardening devices on the client side, server side, patching them regularly. Think Microsoft Intune. Think data protection with Microsoft Purview, protecting the confidentiality, integrity, availability of data across that IT spectrum. Segmentation, so segmenting your network, isolating segments. So think of potentially a risky medical device. You're creating a micro segment around that medical device. You're limiting what can go into that segment, what comes out. Again, to limit if an intruder comes in that way, or malware comes in that way, like ransomware, you're limiting that impact to that segment. Access verification, again, done throughout. And then there's this principle of, or the security control of monitoring and detection and response. So think, the integrated security suite, integrating alerts up through SIM or security information and event management with Microsoft Sentinel. Think, Microsoft Defender threat intelligence, feeding external threat intelligence in, monitoring with technologies like Security Copilot to empower the security analysts in the Health and Life Sciences Security Operations Center, again, to do that monitoring, quick detection, response, containment, and remediation. All right, so if we think about integrated workflow, it's all about reducing technical debt, right? So you heard from the DocuSign team about the extensive integration we have with DocuSign solutions in the Microsoft Cloud across Azure, Dynamics 365, Microsoft 365, Power Platform. And that's all about getting you up and running quickly, accelerating your time to value, avoiding you having to take on an integration project. Now, a similar value prop exists in integrated security, where you take the Microsoft Integrated Security Suite, it's all integrated up front, you get it up and running quickly, you don't have to take on the technical debt of doing that integration yourself. And so you again, get up and running quickly with your security. It's efficient because everything's integrated. You've got single dashboard. You reduce risk of missed alerts. You empower your security operations center with AI and Security Copilot, and ultimately improve that continuous monitoring, detection, and response, and ultimately improve the agility of the healthcare organization to innovate. The last thing I want to talk about is compliance. And so this is information privacy and security compliance. So Microsoft Cloud has an extensive portfolio of compliance certifications. You can look at Microsoft Trust Center for the details, but suffice it to say that includes HIPAA, it includes high trust at the highest level of assurance, the R2 level across Azure, Dynamics 365, Microsoft 365, and Power Platform. GXP, or specifically 21 CFR Part 11, the ISO 27000 series, GDPR, and there's many, many others. But remember, that's the Microsoft Cloud Foundation. And as you put workloads on top of the cloud, you got to make sure those are compliant. As you have an end-to-end IT spectrum, and we looked at the complex IT spectrum, you got to make sure that's compliant end-to-end. And you got to make sure your organization as a whole is compliant, because compliance requirements often go outside of IT. There could be a requirement to have a CISO. There could be a requirement to do a risk assessment and things like that. So this is all about protecting the confidentiality, the integrity, and availability of data, specifically protected healthcare information or sensitive healthcare data. And always remember, there's the cloud foundation, there's the workload you put on it in your end-to-end IT in your organization. What we want to make sure is there's no confusion that just because you're running a workload on top of Microsoft Cloud doesn't mean you're compliant all up. You can inherit the compliance that we do, and that's a huge accelerant or boost for you. But there's a shared responsibilities model in there. So really important to understand shared responsibilities, inherit as much as you can from Microsoft, from Docusign, but be aware of what your responsibilities are to ensure your compliance on an ongoing basis. So the last thing I want to touch on is high trust compliance. I mentioned the Microsoft Cloud is high trust certified at the highest R2 level. That really helps us across the US and increasingly globally, where high trust is increasingly recognized. But also we're doing some very exciting things with high trust around global compliance scale program, which helps streamline compliance for global scale and helps accelerate solution adoption and time to value. And with that, I'm going to hand back to Christina.
Thank you, David. Well, I really hope that all of you have seen that there doesn't need to be a trade-off between productivity and security. With the Docusign and Microsoft integration, this truly means that you can just really be able to optimize your current investments and systems to get more out of there. And you can see with Ron's case studies that our customers truly have had incredible gains with full-time employee hours being freed up, millions of dollars saved on their cost savings. This is just massive, and it's just right here at your fingertips. These are out-of-the-box integrations, and they're highly secure and trusted, where Docusign and Microsoft has purpose-built products just for the healthcare and life sciences industry. This is truly going to help make your patients, your staff, your employees, the clinicians, in the entire pharmaceutical value chain and vendors, as well as throughout your care continuum, seamlessly operate in a really new way. This is going to be transformative. So I really encourage you all to please scan this QR code on the right-hand side to learn more, to contact us as well. We really welcome questions that you have. I do have a few here that we're going to cover, so why don't we now just transition straight into the Q&A. So the first question is, I believe for you, Ron, it's where can I get the Docusign value calculator?
Great question. So the value calculator is for Docusign customers, but for those that aren't yet, there are three main components that go into the productivity value calculation. So annual volume, your process time per unit of volume. So remember, that's that total time expended by staff that are involved in the workflow for one workflow cycle. And you'll want to have that metric for both your manual or legacy process as well as your digitized or improved process, because you're going to need that delta for the calculation. And then the average fully loaded hourly rate for the staff that are involved in that workflow. And remember, that's that salary plus benefits average rate. But for a full, accurate analysis, please contact your Docusign representative and they'll be glad to help you.
So Ron, it sounds like you can be a customer and you'd get the full calculator. And if you're not a customer, how would you suggest that these customers actually track those metrics that you suggested? Do you have to engage different employees or teams? I mean, what have you seen other customers do?
Your boots on the ground employees, I find that they usually are the ones who can give you your process times, especially your annual volume. You may have to interact with your IT department for them to pull volumes for you. And then that fully loaded hourly rate, you'll want to contact your HR representative and have them provide that information to you.
Excellent. Thank you, Ron. And you've done this for hundreds of customers for Docusign. So thank you for sharing those insights. The second question we have is, how do you achieve HIPAA compliance? Docusign is very much focused on this, but I want to give an opportunity for Microsoft to talk a little bit more about their HIPAA compliance. So David, do you mind taking that?
Sure, happy to, and feel free to add. So Microsoft Cloud is HIPAA compliant. So what that means is it's absolutely possible for health and life sciences organizations that put workloads on top of Microsoft Cloud to achieve their own HIPAA compliance. Microsoft acts as a business associate. We provide a standard business associate agreement to covered entities and other business associates. But it's important to realize that HIPAA compliance is not just the cloud, not just the Microsoft Cloud Foundation. It's the workload you put on top. It's Docusign, as you mentioned, Christina, and then it's the end-to-end IT. You know, it's the mobile devices, it's the on-prem, it's multi-cloud. If you're doing that, it's all of those things, right? So there's a partnership there that we provide to Docusign, of course, but health and life sciences organizations to help them be compliant with HIPAA all up.
Thank you. And Docusign is completely aligned with what you've mentioned as well, where we do BAAs and we help enable customers to be HIPAA compliant as well. So I'm going to go to the last question that we have here, which is, how does Docusign and Microsoft monitor potential threats? So I'll go ahead and start, and then David, I'll kick it over to you. So Docusign has a product called Monitor, and this is integrated with Power BI, but Monitor allows your organization to detect any potential threats from unauthorized users. So that means anybody accessing your system needs to have valid credentials. And if they are not, there are rules-based alerts that you can implement that then you would get alerted in Power BI if something is detected. And this helps your security team be able to investigate incidences thoroughly, and they are really able to get in-depth data about that activity that triggered that alert. So the administrators can respond quickly, decisively. They can mitigate these threats before it causes significant damage. So the Monitor in Power BI is one of our most powerful tools that we have to monitoring your system. David, would you like to speak to this as well?
Yeah, it's such an excellent question. And just to build on that, so we talked earlier about how zero trust security is really important to our strategy and our approach. And we talked about how continuous monitoring is a very important element of zero trust. And Christina, you talked about some great capability from Docusign in terms of Microsoft, how we augment that. This integrated security. So think Microsoft Sentinel for SIEM, or Security Information and Event Management. It's bringing up all those security events and information to the SOC team, the Security Operations Center, the security analysts inside the health and life sciences organization. There's Microsoft Defender Threat Intelligence, which is bringing in new threat intelligence from Microsoft worldwide. There's artificial intelligence with Security Copilot, which is empowering the SOC team to ingest all that telemetry from their local environment, that complex end-to-end IT environment, to ingest that inbound threat intelligence, to identify new security incidents, to provide recommended summary action plans, to accelerate investigation, to accelerate reporting. So there's all of those things in terms of Microsoft integrated security and AI powered with Security Copilot to provide, again, that foundation and partnership beyond what Docusign does.
Great. Well, those are all the questions we have today. So I wanted to thank you again, David and Ron, for today's discussion and sharing with what the customers have done, as well as the extensive trust and security that Microsoft has in relationship with Docusign. So thank you, everyone, for your time today. I hope you've learned about all of the opportunity that you have that should really be at your fingertips. So please contact us. We really look forward to being in touch. Thank you so much. I hope you have a good rest of your day.
Thanks, everyone.
Thank you.